Our today's topic is fascia of the thigh. So, like every other region of the body, the thigh also has two types of fascia. One is superficial fascia and one is deep fascia. First of all, we are going to discuss the superficial fascia of the thigh. The superficial fascia of the thigh is further subdivided into two layers. One is the superficial fatty layer, which is also called the Camper's fascia, and the other is the deep membranous layer, which is also called the Scarpa's fascia. Now, the superficial fascia of the thigh is direct extension from the abdominal fascia. The fascia of the abdomen extends into the thigh, and that is further subdivided into the superficial fatty layer or Camper's fascia and the deep membranous layer or the Scarpa's fascia. Now, the deep layer of the superficial fascia, also called the Scarpa's fascia, is loosely attached with the deep fascia, which is underlying the superficial fascia. But there is a point in the region of inguinal ligament where it is firmly adherent to the deep fascia. That area is called the Holden's line. So Holden's line is the area where the deep layer of superficial fascia plus deep fascia of the thigh are very firmly adherent, and this area is called the Holden's line. Now, the significance of Holden's line is such that if there is urethral injury, Holden's line prevents extravasation of urine into the thigh. So this is the significance of Holden's line. The Holden's line prevents the extravasation of urine into the thigh in case of urethral injury. Now, the contents of superficial fascia are the cutaneous arteries, cutaneous nerves, cutaneous lymph nodes, and cutaneous veins. So, the cutaneous arteries are the superficial external pudendal artery, the superficial epigastric artery, and the superficial circumflex iliac artery. So these three are the superficial arteries of which are lying in the superficial fascia of the thigh. The cutaneous nerves are coming from the lumbar plexus. We are going to discuss this in detail later. The cutaneous lymph nodes are in the form of a T, like this. Now, this area of the T, it drains most of the lower limb. If this is the medial side and this is the lateral side. The lateral side of the T, this area, it drains the infraumbilical area of the lateral side of the abdominal wall, plus the gluteal region. And the medial side, these lymph nodes, they drain the infraumbilical area of the medial side of the abdominal wall, plus the genital region. So the cutaneous lymph nodes are in the form of a T. The vertical limb of the T is mostly draining the lower limb, and the horizontal limb, the lateral part, is draining the infraumbilical part of the lateral side of abdominal wall plus the gluteal region, and the medial side, it drains the infraumbilical part of the medial side of abdominal wall plus the genital area. Another thing that we have in the region of the superficial fascia is the great saphenous vein. This is the longest and the largest vein of the lower limb. The great saphenous vein starts on the dorsum of the foot from the dorsal venous arch. Then it passes anterior to the medial malleolus. Then it passes above on the medial side of the leg. Then in the thigh, it enters what? The saphenous opening. And in the saphenous opening, through the saphenous opening, it finally drains into the femoral vein. So this is the entire course of the great saphenous vein, starting from the dorsal venous arch on the dorsum of the foot. Then it passes anterior to the medial malleolus, goes up on the medial side of the leg. Then it further goes up, and in the thigh, it enters the saphenous opening, pierces the cribriform fascia, which is covering the saphenous opening, and finally drains into the femoral vein. Then we have the deep fascia of the thigh, which is also called the fascia lata. Deep fascia is also called the fascia lata. The deep fascia of the thigh is covering the thigh in the form of a sleeve. So it has 4 attachments, superiorly and likewise inferiorly. Superiorly, anteriorly, it is attached to the inguinal ligament. Posteriorly, it is attached to the sacrum and coccyx. Medially, it is attached to pubis plus ischial tuberosity. And laterally, it is attached to the iliac crest. So if we look at the superior attachment of this sleeve, which is covering the fascia on the 4 sides, or it is covering it entirely, anteriorly it is attached to the inguinal ligament. Posteriorly, it is attached to the sacrum and coccyx. Medially, it is attached to pubis plus ischial tuberosity, and laterally, it is attached to the iliac crest. So these are the superior attachments of this sleeve, which is the fascia lata. And inferiorly, on the anterior side plus all the sides, anterior plus all sides, it is attached to the bony prominences, and posteriorly it continues as the fascia of the leg. So inferior attachment is that anteriorly and all sides it is attached to the bony prominences, and posteriorly it continues as the fascia of the leg. Now there are a few modifications of the deep fascia of thigh. We are going to discuss these one by one. First is the iliotibial tract. So what is iliotibial tract? The fascia lata is thickened on the lateral side, and that thickening is called a band. A thickened band is formed on the lateral side of the thigh, which is actually thickening of the deep fascia, and that is called the iliotibial tract, which is superiorly attached to the iliac tubercle, and inferiorly it is attached to the condyle of tibia. So the iliotibial tract is superiorly attached to the iliac tubercle, and inferiorly it is attached to the condyle of tibia. So these are the attachments of the iliotibial tract. So what is the significance of iliotibial tract? This iliotibial tract gives insertion to 2 muscles. One is the gluteus maximus, and the second is tensor fascia lata. This is the significance of this iliotibial tract, and it also supports the knee during flexion and during extension and partial flexion. So this is the significance of iliotibial tract. Then we have the saphenous opening. As I've mentioned earlier, saphenous opening is an opening in the iliotibial tract which is covered with cribriform fascia. And this is the very opening which is pierced by the great saphenous vein. The great saphenous vein and pierces the cribriform fascia and enters the saphenous opening and finally drains into the femoral vein. This is that very opening, the saphenous opening. This is one of the modifications of the deep fascia of the thigh or the fascia lata. And last one is the intermuscular septa. We have 3 septa. One is the lateral, one is the medial, and one is the posterior. The posterior one is poorly defined. The medial one is attached to the medial lip of linea aspera, and the lateral one is attached to the lateral lip of linea aspera. So the deep fascia of the thigh or the fascia lata is like a sleeve covering the entire thigh on all sides. It has 3 modifications. First is the iliotibial tract placed laterally, then is the saphenous opening, and finally the intermuscular septa are also the modifications of deep fascia of the thigh.